heart disease is a mitochondrial problem. The therapy is really a combination of good fat, modest protein, high vegetable, lowish carbohydrate diet. Strophanthus, if there's any indication of any symptoms or pathology, and Eecp. That's the basic treatment, and I'll tell you, a lot of people will do really well with that without needing toxic drugs and stents and bypasses and all the rest.
We have an epidemic of heart disease in this country, and the conventional treatments don't work well at all. So what does? Hi, this is Dr. Mercola helping you take control of your health, and today we are joined by Dr. Thomas Cowan, who is a physician and has written a book, The Human Heart, which will help answer that question. It's a fascinating book, not very technical, and I think you'd really enjoy it. And for those of you who don't know, Dr. Thomas Cowan is the founding member of the Weston Price Foundation, and he's a family physician, and he has a very interesting history. And I've always enjoyed listening to him. I just take loads of notes, and he's just, what I love about him is he's so humble, and he's funny, and he really has knowledge. He's got a lot of good wisdom in the years that he's put together. But this book is really, in some ways, an autobiography, and he tells his life story in a lot of details that I wasn't aware of. So it's a phenomenal book. And definitely, if you're interested in heart disease, or you know someone who is, or is taking a statin drug, then this is a book you must get. Okay, Tom, did I leave anything out of the introduction?
Only that the actual title is Human Heart, Cosmic Heart.
Okay, sorry. I in my description of it, I abbreviated, so I apologize for that. But it's a great book, nonetheless.
Thank you. I'm so glad you liked it.
Yeah, I think I listened to you lecture in Weston Price in Atlanta, which must be 4 years ago, and listened to you talk about these items for 3 hours, and it was just an absolutely fascinating topic. So you know how best to present it. There's lots of pieces of the puzzle to fit together, but essentially what I mentioned in the intro is that the conventional approach for heart disease is just basically wrong. They're putting in the quarter artery bypasses and stents and putting people on statins to lower cholesterol, and none of it is treating the cause. So why don't you sort of give us the basis and start describing some of the things, and I'll chime in and maybe highlight some of the aspects that you're mentioning.
Okay, and again, thanks for having me come on here. So basically, the book has 3 parts, and for whatever reason, my destiny in my career is that I sort of take on some of the biggest accepted wisdoms. It's just sort of what's drawn me, and I try to figure out whether they're actually true or not. So the first part is, as you said, my story, which I mean, I hope people will be interested, but that's the first part. The second part, I examined the theory that the heart is a pump, and as I'm sure you know, I say that the heart is not a pump, and then I have to explain why the blood moves and what the heart is doing, and actually the interesting ramifications of that. And the third part is the part that you're talking about now, which is what causes heart attacks. And again, it's sort of like mother's milk, conventional wisdom. Everybody believed it. I believed it for a while. Everybody knows what caused a heart attack, which is now here's an interesting point. I learned in medical school there was 4 major coronary arteries. Some places it says 3, and then some places it says 2. So even the basic how many major coronary arteries we have is actually in dispute. It's a matter of semantics. But anyways, so we have these coronary arteries, these major blood vessels, which we're told supply all of the blood flow to the heart. And if one or more of them gets blocked with plaque, then the blood can't get through the blockage. There's say a bottleneck, and the part downstream from that blockage doesn't get any blood, it doesn't get any oxygen, it doesn't get any food. First, it causes pain, which we call angina, and then worse pain, which we call unstable angina. And if that keeps going, you get a heart attack, which means death of those cells. And so the entire edifice of cardiology and the entire edifice of alternative cardiology, such as it is how do we get rid of the plaque? Do we do stents? Do we do bypasses? Do we do angioplasties? Do we lower the cholesterol because the plaque is supposedly caused by cholesterol, although now we know it isn't? Do we put people on no-fat diets, low-fat diets? All that, it's all about the plaque. And my point of the book is it's not about the plaque.
Yes, indeed. So why don't we address one of the intriguing concepts that you mentioned in your response, is with the fact that most people won't believe, is that the heart is not a pump.
Okay, so that's switching topics a little bit, but we can go into that. So the first thing, to be more specific, because with all this stuff, it's very important to be as clear as possible with what I mean. So when I say a pump, and what we're taught in cardiology and in medicine, is that the walls of the heart create pressure, which causes propulsion of the blood through the body. So when I say pump, I mean a pressure propulsion system caused by the muscular contraction of the ventricles. That's exactly what I mean. Now, the argument against that, if you would, is, and by the way, that started in 1648 with a guy named William Harvey who wrote a book about it. And ever since then, we've believed that that was the case. But if you actually take a look at this in more detail, the first thing you notice is that there are, and it depends how you look at it. You could spread the blood vessels out and it would cover 3 times a football field. So that's a huge amount of blood vessels in the heart. Another way to put it is, if you put the blood vessels end to end, so in a series, it would encircle the earth 3 times. So that's a huge amount of blood vessels. And the liquid in the vessels, meaning the blood, is this very sticky, viscous fluid with a bunch of stuff floating around in it. The stuff being red blood cells, white blood cells, platelets, etc. And interestingly, most of the blood vessels are capillaries, which are very thin-walled, very narrow tubes. And the stuff, meaning the red blood cells, is about the same diameter as the tube. So if you put that together, let's go with the 3 times around the earth. And if you're listening and you say, well, it's not quite that long, let's say 1 time around the earth. So in other words, the pump theory is you can have a 1-pound, somewhat thin-walled organ, and it's going to pump sticky fluid around the earth. And it's going to do that every single day for 70 years, 60, 70 times a minute. And that 1-pound thin-walled organ can generate enough pressure by squeezing this thick blood 3 times around the earth. And frankly, I don't know what other word to use, that's ridiculous. But the interesting thing is it actually gets worse than that, because it turns out if you do a flow velocity diagram, it turns out that the blood is moving the fastest at the heart, both before and after the heart. And then as it goes through the arterioles and then the smaller arteries, it gets to the capillaries, which are the transition vessels where the blood and the gases are exchanged. And there it actually stops and does a little shimmy, or it goes very slow, depending on who you believe, but it has to go very slow. The analogy is a narrow river goes fast, and when it goes out into a wetland, it's going very slow. And it has to go slow. It has to stop almost to exchange the blood, the gases in the food. So not only are we pushing all the way around the earth, but halfway around our travel, we stop, and then we get going again. And you're expecting that to be all from the push from behind. And again, frankly, that's ridiculous. And it even gets worse than that, because we have an outflow tube of the left ventricle called the aortic arch, which I'm on the video so I can show you. It's shaped like an arch, like McDonald's arch. So the blood goes from the left ventricle out the aortic valve, through the arch, and then down to the body. The analogy I like to say here is if you stick a similarly shaped arch garden hose off your spigot outside of your house, and then you turn it on really hard, which recreates the pumping, because we need a really big push to get 3 times around the earth, you would expect the garden hose to straighten out, because if you put pressure, the arch would straighten. And in fact, you can look on any angiogram, a catheterization, and you can see the arch actually bends in a little bit during systole, which from a pressure propulsion model makes absolutely no sense at all.
Yes, indeed. So I think you provided some very compelling information that to show us, at least intuitively, that the heart is not a pump, but probably serves another role, because obviously if our heart stops beating, we're not going to be living very long. So I believe in the book you describe it as a hydraulic ram. And then, so maybe discuss that, but then if the heart isn't doing the pumping, then what is? It needs some alternative energy source. And that's a really intriguing component of this, because we talked about a lot of the principles in our site about this. And this helps tie together and helps explain how that blood actually moves those 3 times around the earth.
Right. So, and it's really beautiful when you see it. And I know that you have interviewed Gerald Pollack maybe a number of times, and his work was instrumental to me understanding it. So now we're to the question of, so how does the blood actually move if it isn't being pushed or pumped by the heart? The first thing you'd have to say is, well, we know that the pump must be at the capillaries, because that's where the blood has stopped. So if the blood stopped there, we need to somehow pump it or push it to get it going again. And then as it moves up the venous tree, the blood vessels will narrow, because they're eventually coalescing to come back to the heart. And just the narrowing of the tubes will make it go faster. And besides, there's valves and there's muscular contraction. But often people say it's the movement of the muscles. That's what squeezes the blood up to the heart, which is also nonsense, because easily proven by that would mean if somebody was paralyzed, they wouldn't have the blood go back to their heart. And clearly that's not true. Not to say that there isn't some help, but that's not the reason. The reason is, as Pollack has described, water can exist in 4 phases, not the 3. And the 4th phase of water is formed by the interaction of water and a hydrophilic surface. And what happens with that is you form a gel layer or a protective layer on that hydrophilic surface, which is negatively charged, and therefore the opposite, the positive charges, dissolve into the bulk water in the middle of the tube. And you can see this. He's put U-tubes of water flowing through tubes. And it's just all you need is a hydrophilic tube, which forms a gel layer, which is negatively charged. And then the bulk water is positively charged. The positive charges repel each other, and that starts the flow going up the hill. And as Dr. Pollack has also very clearly demonstrated, the energy for the separation of charges is basically 3. One is sunlight, which I also know you've talked about a lot. Sunlight charges up the tubes and increases the flow. The other one is the energy that emanates from the earth, and that's called earthing. And that also charges up the tubes, creates this separation of charges, creates more positive ions, and starts the flow going up the hill. Both of those, luckily, are free and abundant to any living system. The third one is just the field effect from another living being, like laying on of hands. We have a certain electromagnetic, I think it is, emanation from the palms of our hands and just the touch of our skin. And that also, Pollack has shown, charges up these hydrophilic tubes and makes more flow of the liquid inside. So the three things that charge up our tubes and therefore pump the blood are sunlight, the earth, and the communication touch from another human being. So what could be better than that?
Yeah, it's ideal. And another concept which helps solidify the information you just presented was it's helpful to view water as essentially a battery. And
Yes.
what you're doing when you expose your skin, not just going outside, if like it's as we're recording this, it's winter is approaching. We're deep into fall, and many people are not going outside without a shirt and wearing shorts. So, but if you do, there's still benefit, but you're not going to, it's actually the sun penetrating your skin that provides it. And it's interesting because when that happens, there's a massive increase of nitric oxide, which vasodilates, and you can shunt literally 60% of your blood to the surface of your skin to absorb this radiation and then structure the water. So that is a key component if you want to have a healthy heart. You have to, and the ideal is to be exposed to that sun while you're grounding, so you're forming a biological circuit, which makes it work even better. Well,
absolutely.
I guess the best would be holding hands with someone, your spouse.
Yes. So you got it exact. The best thing is to be more or less with shorts or naked-ish on the beach with the salt water, which acts as an electrical conductor, holding hands with somebody you love.
Right. That is.
And I tell you, if you ask people, when do you feel the best in life? They say, oh, the time I went to the beach and I walked on the beach for 2 hours a day holding hands with my best friend or wife or husband or whatever. Yeah. There you go. That's exactly what you said. That's how you structure the water. Exactly what you said. The water is a battery. And those inputs separate the charges, charge the battery. The battery does work, and it starts flow. And that flow, just through Bernoulli's principle, which is the wider it is, the slower it goes, narrows, it goes faster. It goes up faster and faster to the heart. And that is the flow that is the reason the blood moves. In a nutshell, you got it.
Yeah, and I think it's an important principle, and hopefully it'll be another piece of information that will motivate, encourage, and inspire people to engage in this process. I was so convinced I moved to Florida, and I'm actually able to walk on the beach for an hour, 2 or 3 hours a day for 90-95% of the days, unless I'm traveling. So yes. I firmly believe in it. But, so that's a really important
principle. One of the best things a human being can do.
I couldn't agree more. I couldn't agree more. I just
free, easy, cheap. Feels good.
No charge.
No charge.
You have to move. You have to move.
You have to move.
And then you can actually play as a child. Play is fun, and that also helps too, because you can go into surf, and it's a lot of fun on the ocean. But let's progress to the next stage, which I think is even more interesting, because as I mentioned in the introduction, the treatment model for heart disease, which is killing 40% of people, is fatally flawed. And we also have another epidemic, which I didn't address, which is congestive heart failure. So essentially cardiac dysfunction, primarily, I believe, due to mitochondrial dysfunction. And there's a whole other area that we can discuss, but there's not enough time to do it because you have so much information here. So let's address some of the ways that you can advise or recommend to people watching this, if they have heart disease or someone they know or love has heart disease, because that's virtually everyone watching this because it's such an epidemic. These are not necessarily preventive strategies. Preventive strategies are what we just discussed that everyone should be doing ideally, but these are treatment options that are essentially have almost no side effects and actually do address the cause of heart disease.
Yes. I think it would, if you would indulge me, I think that means I should talk a little bit about what I think causes heart disease and what doesn't.
Absolutely.
Because I can tell you that I just took a look at some of the information you sent me, and your focus on the mitochondria is very similar to what I'm saying. I mean, in fact, it's really identical in a sense.
And you're referring to the book that I'm publishing in May of next year, the title of which we don't have yet, but it's essentially on mitochondrial dysfunction.
Right.
And how.
So heart disease is a mitochondrial problem, and so I'll explain why, if that's okay.
Sure.
So the first thing is, why not plaque? Isn't that, it's like mother's milk. Like I said, everybody thinks it's plaque. So the argument against that is, first of all, if it's plaque, then it's something in the blood that's causing the plaque, like high cholesterol, or some people would say inflammation, which then should mean that since all the blood vessels, all the arteries are basically the same stuff, there's no difference between the splenic artery or the femoral artery or the coronary artery. And the blood that goes through there is all the same in every artery. If there's plaque in one place, there should be plaque everywhere. And in fact, to a certain extent, there is. And so you get plaque in the splenic artery. And interestingly, the coronary arteries, at least 2, maybe 4 of them. The splenic artery, there's only 1. So here you have this spleen that has plaque because it's in the blood. That's what we're told causes the plaque. So then the question that I asked myself for years is, how come I never heard of a single person? I was an ER doctor for 10 years. I never saw one case of a spleen attack. I never saw a liver attack. I never saw a foot attack. There is such a thing as renal artery ischemia, or that happens, maybe 10 people a year, or 100, or I don't know how many. But basically, there's only 2 organs that have attacks. The brain, we call that a stroke, and the heart, we call that an MI or a heart attack. Why not the other organs? Because that suggests that there's something different about those organs than that, and it's not the blood vessels, because the blood vessels, they're the same. There's something different about the heart and the brain that's causing the attacks, not the blood flow. The second thing is, it turns out in the 40s and 50s, when people were interested in and started this theory, most of the cardiologists didn't believe it. They said, no, there are 4 coronary arteries, or 2 or 3, but there's this massive collateral circulation. In other words, the body is not so stupid to put all its eggs in these 2 baskets. So the flow, even from birth of the heart, is this collateral circulation, this network of fine blood vessels that is the flow. And it doesn't really matter whether one area gets blocked or not, because the whole thing is like a wetlands and it'll just compensate. And then I started looking into, because there was such a debate about this, they did studies to figure out, okay, person did an had a heart attack and died, so they do autopsy studies. How many actually had a blockage in the artery leading to the part that had a heart attack? And to my shock, I found that some studies showed 18%. And those are the people who died, like they had a heart attack and they died an hour later, and then they had 18% blockage. On the other hand, the maximum in the literature that I found, and by the way, all these studies are on my website, humanheartcosmicheart.com, and there's a book that any physician who's interested should read by a guy named Baroldi, and the print version is on the heartattacknew.com website. So he did 40 years of pathological studies, and the highest is 78%. And those are with people who live for a month or a week or 6 months after a heart attack. And all that suggests, first of all, if it's 18%, that means 82% didn't have a blocked artery that caused the heart attack. And even if it's 78%, so what happened to the other 22%? If they didn't have a blocked artery and we're told that is the only reason you have a heart attack, so what happened to them? And the other thing that suggests is that the longer you wait after a heart attack, the more blockages you see, which suggests that the blockages are a consequence of a heart attack, not the cause. So if it's only 18% had a heart attack who died right away, then, and the rest of them developed the plaque afterwards that blocks the artery. So what happened to those 82%? And then you see things like Baroldi talks about a study, 66% of normal 50-year-olds who die of a car accident have a 1 or more greater than 90% stenosis or blockage of a coronary artery. And none of them had any symptoms. None of them have any heart disease. But 66% have a blockage. Now, don't misunderstand me here, and I'm sure you don't, but I'm not saying blockages are good. I'm not saying plaque is good. But what I am saying is it's nowhere near sufficient to explain why people have heart attacks. And the final thing that I tell people, because I see this, once or 3 times a week, every week somebody comes in, says, I'm not feeling as well as I used to. I have some chest pain, a little shortness of breath walking up the hills. I went on a 5-mile walk yesterday and I'm not doing as well as I used to. So I go to the cardiologist, he does tests, and he finds out I have a 95% blockage in one of my coronary arteries. And he said to me, if this blocks any more than this, you're going to have a heart attack and die. So you better have a stent or an angioplasty. So I think to myself, okay, number one, if all of the blood flow comes through these coronary arteries and he's got 95% blockage of this major vessel, how did he walk up this 5-mile hill? In fact, how is he even standing upright if he's got less than 5% blood flow to a major part of his heart? And then, so you mean to tell me, not you, but if he blocks from 5% to 2%, that's it, curtains, you die. The reality is 5% is 0%, and blocking to 2% is the same as 0%. And anyways, it's very clear that the theory that the blood squeezes through the bottleneck in the vessel is complete nonsense. The blood does not squeeze through the bottleneck. It bypasses it. It goes through these collateral vessels, and the flow is more or less normal, although there is some problem in the heart, but it's not because of that blockage. And that's why the Mayo Clinic and other studies, they unblock the blockage, doesn't do any good for the patient.
So I think you provided a really simple and elegant explanation as to why anyone watching this should not accept the conventional recommendations and wisdom to get a coronary bypass or a stent or even go on statins, because that's not the issue. Now,
Not the issue.
That's not what's causing the problem. So clearly the diet is going to be a massively useful intervention, but we don't really have time to talk about that here. I've discussed it frequently on the site, and my new book will go in great detail on that. But there is, when I heard you lecture a few years ago in Atlanta, you had mentioned that there was one specific indication of a blockage, and that was that the left anterior descending, the primary artery to supply the heart, had a 90 or 90. I believe, and I may be misremembering this, you thought that might be a consideration for some type of bypass intervention.
Yeah, if you get a greater than 90% stenosis blockage of the proximal part, that's the early part of the left anterior descending, that's essentially before it has a chance to branch out. So that is a problem. It doesn't always mean it's a problem, but that's the one that is the most worrisome.
Okay, so I didn't remember it being proximal, but thank you. So if you have that lesion, then you may want to consider these other you may want to consider the conventional recommendation, because there may be a small subset of people that actually benefit from that type of therapy. But what I think is really exciting, and actually you don't talk a lot about it in the book for the most part, but your book is just massively interesting. I read it in one beach walk. It was so fascinating. And you have 2 primary therapies that as an alternatives to the conventional recommendations, and that is Strophanthus and then ECCP, or external cardiac coronal pulsation. So why don't we talk about the Strophanthus first, because it's really intriguing and how it affects the autonomic nervous system and the parasympathetics.
So, and if I keep going to background, but
sure.
If I can do 2 minutes or 5 minutes of, what does cause heart attack?
Whatever you need.
Okay. So if it isn't blockages, then what is it? And I say there's basically 3 causes. One, it could be plaque in a really bad place. That's not the usual, but there is some of that. The second is the failure of the collateral circulation. And interestingly, things like diabetes and smoking and high stress all affect collateral circulation. not major blood vessels. Diabetes is well known to be a disease of small blood vessels. So it could be a failure of the collateral circulation. But the predominant reason is the following. And here is how you get a heart attack. So number one, we know that we have two nervous systems, a central and an autonomic. We're not talking about the central, we're talking about the balance of the autonomic. That is, there's two arms, there's a sympathetic fight or flight, a bear chasing you, run. Then there's a parasympathetic, which is rest and digest, life is good. So when you measure those, over 90% on heart rate variability testing have a decreased parasympathetic tone. And this is from stress, from diabetes, high blood pressure, lots of different factors in life, emotional, psychological factors, etc., cause a decreased tone of your parasympathetic nervous system. So that's the first thing that happens. And then what happens is, under the influence of a low parasympathetic tone, you get some sort of emotional, psychological, or physical stress. And that activates your sympathetic nervous system. What happens with that, which is the thing you write about a lot and talk about, is that shifts your cell metabolism from the mitochondria to the cytoplasm, and specifically from your body, your cells in the heart using fat to generate fuel, to generating fuel in a glycolytic way, or fermentation, through fermenting sugar. So once that glycolytic shift, that fermentation happens, you as you know, you go into a glycolytic metabolism where you burn sugar and make lactic acid. And what happens with that is, just like what happens with the muscles, if you run too much, you get lactic acid buildup in your leg muscle. And then the first thing you feel is cramps and pain. Same thing happens in the heart. That's what we call it. You start producing lactic acid because of this shift in metabolism, the fermentation of sugar. You build up lactic acid, cramps, and pain. The next thing that happens, and the difference between the heart and the brain and the rest of the organs, is the heart and the brain each use about 40% of the sugar, and they can't stop. Like your leg, once lactic acid starts, your leg stops, your spleen stops, your kidney stop, your liver stops. It allows the blood flow to flush the lactic acid out. In the heart, that can't happen. It keeps metabolizing. The lactic acid builds up, causes a localized metabolic acidosis, which necroses or destroys the tissue. Now, the other thing is, when the tissue becomes acidic, the calcium can't get into the tissue, so the muscle can't contract, which is why you see a hypokinetic or akinetic, which means a part of your heart muscle stops moving like it should. Now, I didn't say it pumped, but a heart muscle should move, and that's how we find out people who have a heart problem, is because the heart doesn't move, and that's because there's too much acidity in the tissue, and that prevents the calcium from getting in, and the heart doesn't contract the way it should. The next thing that happens after the difficulty of the contraction is it creates shear pressure in the arteries embedded in that non-moving area of the heart, which then breaks off little pieces, which is the clots that the conventional cardiology fingers as the ultimate cause of this. The clots are the result of the non-moving area of your heart, and the non-moving area of your heart is a result of not getting the calcium into the cells, and that's a result of the acid forming from the altered metabolism in the heart. Now, if all that's true, which is what I what I believe, there turns out there's an adrenal medicine, an adrenal hormone made by the adrenal cortex, which is the parasympathetic organ of the body, called wabein, or G-strophanthine, which is an endogenous, meaning made in us hormone, which has the amazing property of going into the blood, going to the heart, converting the lactic acid into pyruvate, which is the preferred fuel for the heart. So it breaks this central chemical that, when it builds up, actually causes all the trouble. It converts that into a fuel, and the heart can go on its merry way. The other thing is strophanthine, which is from the plant Strophanthus, or wabaine is the chemical name. It helps to create more neurotransmitters of the parasympathetic nervous system. So it does the two things which are central. One, it supports the parasympathetic nervous system. The second, it flushes the lactic acid out.
Terrific. And, you know, one of the problems with using carbohydrates as a primary fuel, which actually most likely the majority of people watching this are, is that it generates more reactive oxygen species and secondary free radicals, which chronically will cause the damage, especially to the mitochondria, because that's where they're typically generated. So, right. And it's, I like to simplify it by saying that the carbs are dirty fuels, dirty in the fact that they generate more free radicals. And I think that the new title for my book is clean, something to do with clean fuel, or not to use dirty fuel for your heart. So,
yes, exactly. So the free radicals poison the mitochondria. They can't make this clean fuel. The dirty fuel creates this fermentation, metabolism, lactic acid produced. You're off to the races. Cramps, pain, breakdown.
Yeah, and the answer is not antioxidants. The answer is to reduce the production, not to sequester them once they're produced. That's just foolish.
Yes.
So why don't you expand a bit more on Strophanthus, because it's not easy to find. You're not going to go to your local health food store and pick this thing up if you have heart disease, but it is obtainable. So why don't you discuss a little bit more about the history and your use with it, which is quite extensive for, I think, at least 10 years, maybe 20.
Yeah, I mean, Strophanthus was first identified by the famous African explorer, a guy named Livingstone, who apparently saw the natives would dip their arrows in it, make a really high dose, and it would stun their prey, and then they could go and, you know, kill it, etc. And he dipped his toothbrush in a Strophanthus extract and noticed a change in his heart rate. It slowed down, and basically from there it became a heart medicine. It's in the same family as digitalis, but digitalis, for instance, doesn't convert lactic acid into pyruvate, and digitalis doesn't support the parasympathetic nervous system. So it's really different. But, you know,
digitalis has one of the highest LD50s, or lethal dose. So
yes.
The ratio between lethal or toxic and therapeutic is really small.
Really small. Because digitalis fat soluble and wabaine, G-strophanthine, is water soluble. So there's a lot of differences. For 20 years in Germany, Strophanthus, so the plant is Strophanthus. The active ingredient is called G-strophanthine in Europe and wabaine in the United States. For 20 years, it was the main treatment for angina and preventing heart attacks. Millions of doses, lots of studies. One study that I found from Munich in 1972, 150 people with angina. After a week of taking it, 144 were symptom-free. After 2 weeks, about 146 were symptom-free. So it has a long history of use. In fact, in the 50s and 60s, there was a test called the Strophanthine Challenge Test in Germany, where if you didn't, you know, like we all physicians know, sometimes a person will come in with chest pain and you don't know if it's because they're breathing too hard or muscle pain or something. So you want to figure out whether that's from their heart, and they could take them when they were having chest pain and give them G-strophanthine, and if the pain went away, it was considered from their heart. So that was the G-strophanthine challenge test, because simply it flushes the lactic acid. No lactic acid, no pain. And it's not just a pain relief, it actually breaks the cycle that leads to heart attacks. And then there was a whole thing about, well, it doesn't get orally absorbed. And I think this was the time when the cardiologists were moving away from it being a metabolic disease to it's all about the plaque in the arteries. They were developing stents and bypasses, so there was, a lot of incentive to push that therapy. And they said, gee, strophanthin doesn't get absorbed orally, and that was the end of it. And so now there's very few places to get it. There's one compounding pharmacy in Germany, which you can't import, and there's a company in Brazil that makes an extract of the Strophanthus seeds, and that's what I've been using mostly for about 10, 15 years, and I've had it tested so I know how much wabaine per milliliter is in there. And I mean, it's been one of the best medicines I've ever used. People can't walk to the mailbox. They take it for a couple weeks. They can walk to the mailbox, go skiing, etc. It relieves their chest pain, and it does the exact things that you would hope a medicine would do. So the place to get it now is a little tricky. What we're hoping to inaugurate, and hopefully by the time this podcast comes out, is people can go to our website, Human Heart, Cosmic Heart, and they can find a practitioner, anybody, chiropractor, medical doctor, cardiologist, who will give it to them, who will supervise. I talk for 15 minutes with the practitioner, explain how to do it. They can get it from us and actually give it to the patient themselves. So we're doing this so that we have somebody supervising, somebody working with people. I mean, I would ultimately like it to be internists and cardiologists. Whether that will happen, I don't know.
Terrific. That is a really great summary. There's a bit more details in your book, so certainly pick up the book if you'd like that, or go to Tom's website. The next one I'd like to intervention that I think is virtually no one knows about is the ECCP. Now, I first heard of this when I was in ACAM, the American College for the Advancement of Medicine, and that's a common intervention they use, and those are the chelation doctors. But when I first heard of it, I was not impressed. I thought that it was a poor substitute for exercise, and boy, was I confused. I had no idea of the mechanism of action and how it works, and now I believe it probably absolutely needs to be considered as an alternative for bypass, unless it's this proximal LAD obstruction for most people, because it will increase the collateral circulation. So why don't you discuss a little bit about that, Tom, and your experience with it? Because to me, it's like one of the hidden gems of natural medicine.
Yes, it's actually called EECP.
Okay, I got it mixed up. Sorry about that.
Yeah, and EECP.com will tell you where there's if and where there's a site that does this in your area. So, and it's a Medicare insurance approved therapy, believe it or not. There's studies that show just EECP alone will relieve about 80% of angina so it definitely got some conventional literature behind its effectiveness. And it's very simple and straightforward. Again, it's interesting. The guy who invented the first one to do angiography, a guy named Dr. Mason Sones, he eventually said, it's interesting because a lot of times the people who invent stuff end up saying, like the PSA, it's not so good after all. So he said, you know what, these angiograms, they don't really work because they don't show the collateral circulation because of the pressure and the heaviness of the dye, etc. So basically, the reason we don't have heart attacks is we're protected by this watershed flow. And if you have a metabolism that's basically a diabetic or chronic inflammation, all the things you talk about, that will eventually deteriorate your small blood vessels, your capillaries. We've known that for 40 years. And then you have a deteriorated small vessel flow. And that's why you don't have enough flow in your heart, not the big vessel plaque. So what EECP does is basically puts big balloons, squeezy balloons on your legs and pelvis, and it's synchronized up with the EKG so that when your heart is in diastole or relaxed, the balloons are squeezing the blood. They're like doing this fourth phase water flow, just a lot harder. And they squeeze the blood up to your heart, and that puts pressure on the flow in your heart. And if you do that for an hour and a half, 5 days a week for 7 weeks, you essentially form a new collateral circulation. It's as simple as that. Putting pressure on it, the blood's got to go somewhere, so it has an angiogenic effect. You sprout new blood vessels, and you make a new flow. And new flow means people all of a sudden don't have angina anymore. Their physical endurance, sexual function, all the things that have to do with blood flow increase anywhere between 20 and 40%. It lasts for anywhere from 5 to 8 years. China has hundreds of them because they don't want to spend the money on bypasses. So if you're 60 and you need more blood flow, you go to an Eecp thing for 7 weeks and you get new blood flow. And I mean, you're also correct. Some people call this passive exercise, because the only thing else that I know of that actually really encourages the sprouting of new blood vessels, there's some herbs that might do it. There's some interest in that. But the thing that you've talked about for years, which is high intensity strength training, what that does to any muscle in the body, and correct me if I'm wrong, is encourages new blood vessel formation. If you're going to make muscle, you have to make more small blood vessels to nourish the flow. So that's what happens. So anytime you're doing, in high intensity strength training or running up hills or whatever it is you're doing, that also does it. Makes more collateral circulation. The problem is,
go ahead, and I'll talk about the high intensity, because there's some concern about that.
Yeah, the problem is a lot of the people who come with heart disease, you can't tell them to do high intensity training or hardly any exercise. The first thing they can do is just lay on the bed and they do this passive exercise. Then they have much more capacity, and then they can get into more of a strength training or some sort of exercise program, and have a much greater capacity to do that after they do Eecp.
Yeah, the concern or the challenge with high intensity exercise, if it's done too aggressively and too consistently, and a person has some type of pathology, it actually can cause heart disease, because it can lead to left ventricular hypertrophy and a consequence called diastolic dysfunction, which essentially decreases the effectiveness of the heart's pumping, so that your ejection fraction, which is a measure of how much blood flows out every cycle, is actually reduced. So high intensity exercise can be a cause for this. And the reason why I'm so intrigued with the Eecp is that there's no type of exercise other than appropriately used high intensity that can induce this collateral circulation. And especially if you have this left ventricular hypertrophy and diastolic dysfunction, which is becoming an epidemic. So, and in addition to that, it also creates stem cell production, which is just profound. I mean, so you get these double whammy benefits, and it seems to be the option of choice, and I couldn't recommend it more highly. And what now, the treatments are about an hour 5 times a week for 7 weeks. So 35 treatments, as you mentioned, the last 5 to 8 years.
Yeah.
Sometimes it's covered by third-party insurers. I think for angina is a valid indication, so it would be covered with according to your deductibles. But if it isn't covered, and if you have an indication where you may need it, this is the thing to get. I mean, if you have to pay out of pocket, mortgage your house because you need this. What is the range of treatments for 35 sessions?
I mean, I've seen it anywhere from $3,500 to about $6,000.
Okay, so about $5,000, somewhere in that range.
Yeah. Okay. Yeah, this combination, and I agree, too much high-intensity training is probably too straining and has a counterproductive effect. So I'm glad you brought that up. But, I mean, people need to move, and they need to flex their muscles and use their muscles. And you're absolutely right. This is the most direct way of increasing the collateral circulation quickly. So the combination, the therapy is really the combination of, good fat, high fat, modest protein, high vegetable, lowish carbohydrate diet. That's exactly what you've been talking about. And, I outline that in the book. Strophanthus, if there's any indication of any symptoms or pathology, and Eecp. That's the basic treatment. And I'll tell you, a lot of people will do really well with that without needing toxic drugs and stents and bypasses and all the rest.
Yeah, and then I think earlier you had mentioned this was the protocol for an myocardial infarction or heart attack, but you implied, but I just wanted to make sure that you reemphasized it, that this is also what is occurring in stroke. So it's the same process. It's not only heart attack, it's brain attack or stroke.
Yes.
So it's under the umbrella of cardiovascular disease, which include both of those diseases. So now one of the aspects of your work that I really am intrigued with, because I resonate with it and am also passionate about, is regenerative agriculture. And you being a founding member of Weston Price, have been interested in this for years. And you go in the book and describe your history of actually first learning about this in Rudolf Steiner's work when you're in the Peace Corps, I think in some country in Africa, and
yes.
Which that was a long time ago, and you've just continued to expand your interest. So why don't you give us a brief history of that, so we can have people know the extent of your passion and what you're doing with the regenerative agriculture?
I mean, I first started gardening when I was in the Peace Corps. I was 21. Actually the youngest Peace Corps volunteer in the world at that time, mostly because I was so disenchanted with school that I wanted to get out of school as quick as I could. So I joined the Peace Corps and taught gardening and quickly learned about biodynamics and, as you say, regenerative agriculture, and have been doing it ever since. I luckily in the last year and a half have taken that to a new level, and we're basically, have a huge garden that we are using in Napa, and we're collaborating with local farmers to provide wild vegetables and all different kinds of perennial vegetables, and just using whatever influence we have to get as much great agriculture and wild harvested seaweed and ramps and fiddleheads and cholla buds, because I believe that probably the second most important food besides good fats is a huge diversity of vegetables in the daily diet. And so, regenerative agriculture or restoration of the land and growing food has been, my life for 40 years. To me, we should be humble and enough to say to the plant, I don't really know what you need, but I know you need everything. So I'm going to put all the minerals, all the compost, all the stuff in the soil, and you figure out what you need based on you're an eggplant or you're a kale or you know what's best for you. Now, what they cannot tolerate is A, being poisoned, or B, just giving nitrogen and phosphorus, and they don't have what they need to do these transformations, which are really life. And now this gets into another thing. We study biology by studying dead stuff, because we don't know the difference between a life stuff and a dead stuff. So we do biochemical reactions. What a plant is doing by sensing what minerals it wants and then transforming that into these monoatomic substances is these are life processes. They're like nuclear reactions, except we call them life. And so they don't blow stuff up. They just do it in the plant with this amazing transformative energy. And that's what life is. But in order for them to do that, they need all the raw materials. And so my strategy with gardening after all these years is put everything in the soil I can, volcanic dust and compost and manures and you name it, and I'll let the plant figure out what to do with it.
Yeah, I like that strategy. And one of the things for minerals that a lot of naturally oriented gardeners and farmers are using are these rock minerals, like azomite and just granite, and and using those to help that. But I'm wondering if you've ever had an experience with something I'm really passionate about, and that is ionic, and the key word here is ionic, ocean minerals, and they're extracted from the ocean with the vortex, and that's how they separate the sodium and the chloride out, because if you don't do it well, it's not going to work. And there's a number of different companies. We work with August Dunnings, who makes the product that we sell on our site, and it's just, but you could put it in the soil, but it seems to work even more effectively if you use it as a foliar spray.
Yes, I absolutely. I do that on the, Dr. Cowan's garden stuff. We sprinkle it in the soil. We, sometimes spray it on the plants. Absolutely. And there are these special places in the ocean where all the minerals come together and they create their own vortexes. And there's this guy in France, I don't remember his name, who's been using these for years.
That's I'm drawing a blank on it too, but he's actually was a national hero in France.
Yeah, exactly.
Okay, I forgot.
I know that dancingwithwater.com website has stuff on that.
Absolutely. And Dr. Pollack's just had a conference earlier this year where they had a few lectures on his water.
Yeah. So, right, it's all this creative energy of the vortex, which is also what's actually happening in the heart. Once we get away from this, sort of pressure propulsion pump model, it's this flow. That's what creates the health of the blood vessels in the heart, et cetera.
So I think we provided people with a lot of food for thought, information, which is the key. And certainly you're not going to become an expert by listening to this interview, but hopefully you've been intrigued and are encouraged and inspired and catalyzed to pursue this topic in more detail, because the potential here to transform not only your life, but those of you, the ones you love, and save them from the challenges of cardiovascular diseases, both heart attacks and strokes, is enormous. And then secondarily, of course, the neurodegenerative diseases like Alzheimer's, which doesn't have the direct mechanisms, but it's pretty similar, especially when it comes to mitochondrial dysfunction.
Absolutely.
So Tom, why don't you tell us your website again and any other recommendations or resources you have for people who want to dig deeper into this?
So the website is humanheartcosmicheart.com, and my intention with that is to really not bore people with all these references during interviews like this, but to put all the references there. I want people to check into it, everything from vortexes and Ormus and the heart is a pump and heart disease, etc. So then hopefully we'll have some sort of newsletter and be able to really develop a community of people who are interested in looking at a whole different way of understanding and approaching heart disease.
Okay, well, thank you for writing such a great resource, and I strongly recommend you get this one and put in your library. And I don't mention that frequently. There's only a few books a year that I think really deserve to be in everyone's library, and this is one of them because it's an easy read, it's a quick read, loaded with great information, and it can save your life or the life of someone you love. So I would highly recommend it, and thank you for writing it.
Thanks so much for watching. Remember, hit the like and subscribe button so you can get more videos that can help you and your family take control of your health.